So no, we don't want the bottom to hit this. So that's why I do like halfway, and then you could just pull it here. And then what are we gonna do?
Dump
pull,
it?
yes, dump everything, but be careful when you dump. And of course, you could use this as a basin, and that's why we place it here. So that's why you only cover part of the table, so you could place this here, okay? All right, so what I'm gonna do, I'm going to check, of course, expiration date before you open. Now, you check expiration date on this. What you're gonna do, you just pour water in here, and then remember, this is going to be additional, so you could just pour this here, and you're gonna use this as your measurement. So guide, you could place this here, here, and then this is your sterile gloves. So everything is sterile, hand sanitized. So at this time, am I clear for my sterile, right? Okay, so what I'm going to do, I'm gonna take this before you apply your sterile gloves. This is very big. That's why I like this kit comparing to the other one. You see? Right here. All right, perfect. So before now I apply my sterile gloves, what do I want to make sure? I need to remove the dirty dressing with what?
Clean gloves.
Clean gloves. So you want to make sure you can't turn your back from your sterile. So what you want to make sure you do, bring this close enough. You don't want to turn your back, or you want to make sure you pull this gloves ahead of time. Okay? And sanitize, and you put on your gloves.
Can you put them in your pocket?
Yeah, you can do that. So now I have a sterile filled. So now I am ready. So I'm going to remove your dressing, Mrs. Brown. And I have a date and time. Make sure your pen is in your pocket. Okay, so when you're ready for date and time. And then gently, okay, does that feel sore? So sorry. Okay, and now I'm going to gently unpack the wound. Okay, now I'm looking at this one, it's serous. And I see a small amount of drainage, and I'm gonna cover it. And now I'm gonna place this here. And also I'm going to assess the wound for Rita and Coca. The color seems to be normal, no signs of infection, and the amount is small and no signs of infection. I don't see any purulent, no pus coming out. Okay, so at this time, what am I going to do? I'm going to do my measurement. Remember, you don't need sterile gloves to do a measurement for your length and width. Thank you. So I'm gonna use this one. I could either do this from the tip to the bottom. I'm gonna place it here. It's about 12. And now the width. Place this here. That's about 3. Perfect. And now I'm done. Okay. Everything goes here in the red. Okay, so now I hand sanitize, and now I'm going to apply what?
Sterile gloves.
So I could do my mix of my gauze. And you could do it here, okay? 1 inch water. Remember, you can touch the outer part of it. Okay, above my waist. Okay, now you can use one of those, because you only need to soak one, because remember this, we need two to cover when you're getting ready to cover the wound. With this and that, and that's all you need. Oh, it has a tip, guys, so you're good. And I don't need this. Okay, all right. So now, if you were to clean the wound, you would have to soak, pat dry inside, and then after you clean it, then the wound. So I'm ready to pack the wound. So what I can do, I could take the tweezer, pick it up, and then now I'm going to unfold it. If you like this one better comparing to the other one, you're welcome to do so. But just so you know, the gauze and the skit, they're much smaller. But this is not a big one anyway, so you could just use one. And right before you're ready to pack it, what you're gonna do? Check the depth. Okay, so I'm going to go to the deepest part of the wound and then eyeball. Okay, about 2.5. So I don't need this, and I can pick up. You see why you have two there? Now you're going to pack the wound. So you have a little, maybe a little discomfort, but it's not gonna hurt you. I'm going to pack your wound at this time. All right, Sprout. Okay. So this is what you use this swab for. Make sure it's not dropping or touching the outer part of the wound. Gently, and take your time. You see, the wound is packed. So at this time, you're done with this. I'm going to cover my wound now. Take one. So it has 3 layers. So it has exactly what you need in there for your CBE. And now the ABD pad's going to do what? Cover the wound. Okay, and now I have my tape. Cover the wound. See, the tape holds better than the smaller part I was gonna use. So the reason why I can say I like this one, just in case if you forget what supplies to get, everything is there for you. But you just have to bring your swab sticks and then your sealing. Okay. And this is the last part of it. And now to date it, I need what? Pen, your initial, time and date, and you write everything you need. And then you place it anywhere. Just want to make. I am done at this time. So what do I do now? My DC how, and that's it. So call light within reach and lower this bed to my working level. You.